Now that you have just completed your 6th cycle of R-CHOP therapy, and we're looking forward to what the future holds, I think there is sometimes anxiety on the part of the oncologist and also the patient, because we know you've had good scans along the way. But what is the real likelihood of this being your very last treatment and you moving on to returning to your normal life? I think those are the questions that I have, probably more importantly that you have, and we're now headed down that journey. Now, Whitney is, again, at the end of the completion of her chemo, but I view lymphoma and cancer as a spectrum that goes from the day you are diagnosed until you pass away, and hopefully you pass away at the normal life expectancy from something other than cancer. If that happens, I've done my job well. But it is something that your whole life we will be part of your journey. And there are times where I'm managing chemotherapy and I am delivering good or bad news, and we're talking about a plan as to how to tackle that. And then there is going to be a time point when we are no longer focused on lymphoma and just focused on your general health. Now again, it's important to know that there are several different types of lymphoma, and you have a type that should be cured. And there are time points when we will use the term cure, and there are time points when we talk about remission. And right now you are in remission. And again, it's important to have those discussions with your oncologist to know when can you feel comfortable saying I'm cured and when do you no longer need to worry about this. So I have my own definition of when you're cured and when you no longer need to worry, which is probably different from your perspective and your definition. But it's generally when you hit 2 years out and your lymphoma has not come back, we feel pretty confident that there is at least a 99% chance it's never coming back. And then our focus shifts and we start talking about, again, is your heart healthy? Are you going to live a normal life expectancy? Do we need to worry about other cancers that may come along because you've had one? You've had chemotherapy. What is the risk for other cancers? So those are the conversations and the focus of our conversation. But let's hear your perspective on this.
I think you've articulated exactly what my anxiety is about this. It's, I probably wouldn't ever say I'm cured. I think I always have that in the back of my mind. I was bit once, I could be bitten again. And I think that's probably a normal response. I don't know how you've experienced others, but I think it sort of cuts you short. I think one of our conversations you said this is a life-changing event, and it certainly is. You take for granted, I just have a little lump on my neck, to no, this is going to be different for the rest of your life. And so I do have that anxiety that sits with me, but everything else we've talked about has been accurate and it's worked and it's come through. So I have hope in that I'm going to be that person that gets to use the word cure, but for the time being, you wait for the other shoe to fall, I think, a little bit. But I think it'll take a long time for me to get comfortable that this is behind me, and hopefully never in front of me again. But right now it's with me, and I have to live with it every day, and I treat it like I'm living with it every day. Yes, I have the comfort of knowing that I had clear PET scans, but the lifestyle changes that I've made to make my body stronger and healthier are things that to me are now just how I have to live my life, not I'm through with cancer, I get to go back to the old way. So I think that's how I feel about this.
And I think those are good thoughts. We will do a series of scans over the next few years, and each doctor has a different approach to this because there is not good clinical trials or evidence to tell us how to do this. So I think that creates some anxiety because you may talk to other patients who are on a different schedule or may not be getting scans, and there will be a point when we talk about not getting any more scans, and that creates more anxiety. So from my perception, it's just very different when you're undergoing chemo and we're talking about side effects and we're talking about when your next cycle is going to be and when your next PET scan is going to be, to talking about, I don't think this is going to come back, but these are the things you need to call me about. And that's when we start talking about symptoms. And the other question that will come up is, well, I had no symptoms, or I just had this lump. What should I be watching for now that you're done with treatment? And anything could happen again, meaning you could have a lymph node in the same area or a lymph node in another area. You may just experience weight loss and progressive fatigue. You may have no symptoms and we get a scan and there's something there that needs to be explored. So everyone will have a different experience at this time point forward. I think it's important to know that unless you have another biopsy that suggests your lymphoma is back, we don't rely on scans alone. And we will listen to you about symptoms, and we will be concerned about those B symptoms that we often talk about, but we'll also be concerned if you have something else happening in your life that's just getting worse and worse and no one can figure it out. An example I used is I had a patient who was having progressive back pain and they thought it was sciatica. They were doing physical therapy, it just kept getting worse, and finally someone ordered an MRI and we found the lymphoma had recurred. So it may not be as simple as a lymph node that you can feel, or weight loss, or night sweats, or fevers. It may just be a symptom that's progressive, and until we get a scan and look into it further, we may not know it's lymphoma. Not to alarm anyone, but I think that is the thing we focus the most about, and your oncologist can guide you in terms of what that time frame is that we need to be worried about lymphoma. And, with the type that you have, once you hit 2 years out, and even 1 year, we sigh a big relief that you're going to do well. And again, I think that's where we're headed here. But if you don't do well, what's happened in the field of lymphoma in the last few years? Well, the one thing that's changed things dramatically for something that you're living with is CAR T-cell therapy, where we harvest your immune cells, we modify them, we give them back. So there are transformative things that have come along just even within the last year that should give hope to all patients, whether you're someone that's cured and we're just worried about you getting back to your normal life, or someone who unfortunately is facing with their lymphoma come back. There are so many options. I think the important thing to know is don't assume that you have none and that anything we do will be too toxic and you're not up for it, because it may not be the case. And secondly, things change so much, in even the span of 6 months sometime with this disease, that it's exciting to say that I don't know exactly what the future holds for someone like you. Any other concluding thoughts?
This has been an incredible journey, I can say, but I think, I feel like I've made a friend throughout this, and that it's a different perspective, but I see life very differently now with a different lens. I'm a lot more hopeful. I have a different perspective. A lot more empathetic to people that I meet, which I know has nothing to do with lymphoma, but I think the experience has impacted me in such a way that I do think it's made me be more open, and I think that is the key here. I think for patients that are going through this, to be able to be open, share, have conversations. There is nothing too personal to share with your doctor, because it's only going to benefit you to be able to have feedback into what you're experiencing. So I think that's been helpful for us and helped me get to where I am here today.
So thank you for sharing. I know this is probably not easy, and I really do appreciate you providing your perspective on your journey. And I really appreciate all of you who have joined us for this cure discussion on lymphoma, something that I care very deeply about. But again, the outcomes are so good. We champion our patients every day. So thank you.